Welcome to Stat, I'm telling you all medical true crime stories, and it gets bizarre. Karen Wickham, yeah, she used to work in ER, and now she's sharing the knowledge, so let's get involved. Hey, funny and scary at the same time. Medical mysteries, all facts, she ain't lying. So tune in to Stat if you dare, cause crazy things can happen anytime, anywhere. Yeah.
Hello, everybody out there in podcast land. Welcome to Stat, Shocking Traumas and Treatments. And I am your host, Karen Wickham, coming to you from beautiful Toronto, Ontario, Canada. Hi, guys. I'm not alone today. I have the lovely Miss Heather Wright here with me. Hello, Heather.
Hello. Nice to be back.
Hello.
Hello.
How's it
I'm
go?
cold.
Twiddly-dee, potato. Potato. So yeah, we have Heather back again, and we're going to go over the psychology or the psychiatric background or psychopathy of another serial killer, and this one will be Harold Shipman. Okay, so let's get started into this dude, Harold Shipman. I know most of you have already listened to the series, but let's do a review about this guy. So he's a British serial killer. He worked in England as a doctor, and he attended Leeds Medical School, and he began working as a physician in 1970. Between 1970 and his arrest in 98, he killed approximately 215 of his patients, but the number is believed to be well beyond that. I mean, up to 260, but I mean, he killed over 500, close to 600 of his patients died, which is way, way more than any other doctor would have in a general practice. You're not a specialist.
Yeah. And that, I mean, I know you literally just got started, but that was something that was so alarming to me. Like, I mean, I get that a lot of physicians will have tons and tons of patients over their career, but I just felt like his patients, he had so many, and it was just like, I feel like that would have been a red flag because he just like rolled through them so fast. And it was like never really substantiating like any type of connection or relationship with them for any long period of time. Like, for instance, myself, I've been with the same family practitioner since I was 12. I'm 31. Mm-hmm. Like, it's, I mean, I just feel like all of his just went so fast, obviously, because a lot of them died due to him. But
for sure. Like, I mean, if you're working in a specialty like ICU, ER, you say cardiac, palliative care, you're going to see a lot of deaths. Just it's part and parcel with that, but not a GP.
Right. Yeah.
Like it just, especially one that would do house visits and stuff like that. You know, that means that those people are still in their homes and doing okay. So right. Yeah, so this dude was a horrible person, to say the least. How he killed them was with it was like understatement. He was horrible.
He was like kind of not great.
Yeah, he was just a little, I don't know. So he would inject his patients with or his victims with lethal doses of Demerol, which is a painkiller, and another one which is it's diamorphine, which is also known as heroin on the streets. But you know, it's a drug that can be prescribed and used, or at least it used to be, because it wasn't, you know, it's kind of like the fentanyl, you know, or the oxy of now.
Yeah, so that was actually my question to you, since you have been in you know, healthcare and stuff. So when I read that, I was like, heroin? Why was this old lady on heroin? Like, what? And I started digging a little bit deeper, and then it said diamorphine. I was like, I did not know that was the same thing. But I do know that, like, when people are coming off of like certain drugs and they're in like rehab, they are given very, very strong doses of other drugs, like amphetamines. When they're coming off of amphetamines, they're put on something. I don't know why it's slipping my mind right now, but I was like, is that what this is? Is that like kind of what this started as?
Well, I mean, any of your like codeine, morphine, those kind of things, right? They're all opiates, and some are man-made. and
Yes.
some are
Synthetic.
like straight from the real deal. So, morphine's got, morphine kind of when it hits your system sort of has the same effect as heroin. And that's why it's so addictive. But that's it just gives an idea of how strong the medication he was given. So let's get into his
I
back.
was blown away with that.
Yeah.
Because the daughter was like, heroin? My mom didn't do drugs. And I'm like, no shit. Like, she was like 80 something. Like, why was she on heroin?
Yeah, no, it's crazy.
So weird.
So going back to his childhood, I love covering the childhood of these monsters because
Yes.
I think there's so much revealed. And I don't know if we'll ever, can we ever catch this? Because so much, we're going to get into this nature versus narcissism. By the way, that's the name of Heather's show. One of her
Small
podcasts. Plug. Small plug. Okay, so he was born on January 14th, 1946 in Nottingham, England. He was a middle child. His family was considered middle class. I believe his dad was I forget what they call a lorry driver, which is kind of like
a truck driver.
Truck driver, yeah. And his father really didn't have a lot to do with the family. His mother, Vera.
Surprise, surprise.
Yeah. was a very domineering woman. And she, Harold was her everything. And she instilled in him a sense of superiority, which in turn tainted most of his relationships later on. So he walked around thinking he was like the best of the best of the best. And can you imagine how his brothers and sisters felt? Like, you don't hear much about them, but they didn't turn into serial killers, that's for sure.
Right. And I'm just wondering, if we're going by statistics, should I be looking out for my siblings?
Maybe.
I have 2 younger sisters and 1 older brother.
Maybe. Are you the serial killer, though?
No.
You have the education to know.
But here's the thing. The one that usually researches everything usually isn't the one who's doing it.
Yeah, that's true. So I'm clear, sort of, right? Shh, don't tell
I'm cleared. I'm totally different from everyone in my family.
We'll talk later.
Okay. Awesome.
So she just piled every bit of her love and adoration on top of this guy and basically told him his poop don't stink. And he just developed this attitude of superiority right from the very beginning. But, she did do some weird stuff that I think that might have been, for instance, his brothers and sisters would just wear regular clothes, but she dressed him up in little jackets, ties, and short pants. With the socks up to his knees and the shoes. So he looked really weird compared to other kids, right? He was this little Jeeves walking around.
He was kind of like a Benjamin Button type. He was the grown-up man in a tiny little kid body.
Exactly. But, so I'm sure he was made fun of for that. So, and maybe that just gave him another whole sense of either that, humiliation, but also feeling this superiority, they just don't get it. I don't know. But, So yeah, she was a domineering, woman that neglected her other kids and just, piled it all onto him. So later on in the year, she was diagnosed with lung cancer and, she got so sick that she was in her home and her doctor would come do visits and give her morphine injections for the pain. And sometimes there would be a long period of time in between when she could get the injections. So she'd be in a ton of pain, and then it was where the doctor would come, it would wear off, she'd have to wait a bit longer, the doctor would come and give it again. So I think Harold saw the power in that, right? That you take someone who's suffering, relieve it, suffering, relieve it.
He had this, and we'll get into it later, this God complex. He saw that this doctor was able to basically turn everything on its head, 180 everything she was feeling.
Yeah, exactly. And so she eventually passed away in 1963. And so yeah, that was sort of the events that led to it. So he got over attention from his mother. She gets cancer. She gets sick. He is at her bedside. Like, he would come home at lunchtime and stuff like that, or rush home after school to take care of her and be at her bedside. So in one sense, it sounds like he's a real good doting son, but in another sense, it's like, that's a little weird that he would, want to be there for when the doctors were giving the injections. I don't know. We can look at that at different ways. So he took his mother's death very hard, and then he decided, like, I'm going to go to medical school. And he didn't really show any signs that he wanted to do that before, but all of a sudden he wants to be a doctor. Now, also too, in this time, like when his mother died, he said nothing to anybody. And it was until like a week or two later where his friends were like, I heard your mom died. He's like, yeah. Like, it just, like, no, his reaction, people have talked to his friends and said, like, it was just so strange that he had this reaction. The other thing he started to do at the time was run. He would run just, I don't know, a couple kilometers a day. He just got into running hardcore. I
could see that, a way to cope and try to get things off your mind. But the whole thing that nobody knew, like, I didn't see that part. And that's really interesting to me, because because for him to be so close to her and be doing all that stuff and then not express that to anybody, it's just kind of odd to me.
Well, yeah, it's like this turning on and off of emotion and keeping things like to the chest. So again, he's still young then, so we don't know, maybe it will reveal itself later on. But so he was a loner. And when he went off to medicals, when he was, okay, let's just back that up. While he was in grade school, in grade school, he wasn't that great of a student. He just barely scraped by. And then when he got into high school, his grades still weren't all that much better, but he became a rugby player, and he was like the captain of his team. So he became, So, and there's a case that I'm covering right now where it's another English doctor who mimics this guy. Not mimics, they are almost to the exact same. I'm covering Andrew Wakefield, the anti-vaxxer guy.
Oh.
Yeah, none of you know that,
but
now you know now.
Cover that.
So we'll have to go over that together because they're almost the same.
Oh,
except for,
that's interesting.
Wakefield didn't directly kill anybody. Okay, so he rugby player, and then he was like, considered sort of a handsome dude and all that kind of stuff. But he, oh, I know. Well, who they call handsome, I've never get.
I don't understand.
That
like,
handsome Ed Camper.
Like trolls or something.
that gorgeous what's his name? Ted Bundy. Oh,
they're all gross. We can get into that in another episode. But well,
I don't know. I think people are trying to, like, there's this fascination with serial killers and then, like, they're trying, I don't know. There's this hero worship for some of them. We're just trying to figure out these sick fucks out. And everybody's like, ooh, he's so handsome.
They're like fawning over them.
Yeah. Oh my God. Okay. So in high school, he started to do really well in terms of popularity in high school and then into college. He was this rugby guy and people fawned all over him, but he didn't have a girlfriend. His friends were very distant. He was a very cold kind of guy. So while in college, university, he, again, just barely scraped by with his marks, but managed to pass. And he, during this time, met Primrose. Such a crazy name.
I love that name.
What?
That name is so pretty.
You think so? I just think it sounds like a stuffy little English girl. Primrose.
I've never heard a person be called that. Like, I've seen street names, and I'm like, oh, that sounds like a pretty flower.
Yeah.
But
well, Primrose turned out to be not all that pretty of a flower, because she turned out to be kind of, well, you'll hear. Okay, so Shipman was 18, she was 17. They met on a bus one day, and then they kept seeing each other on the bus. One thing led to another. She got pregnant, they got married, and he resented that, though, because, he wanted to... He wasn't exactly pleased that she was pregnant, so he married her. I don't think he ever loved her, because I think in developing this sort of persona of I'm a doctor needs to be married, especially back in those days. Like, it was a sort of a thing that doctors, lawyers, more professionals didn't really get jobs or do that well if they didn't have that family. They weren't seen as having that stability. So, he gets married. They end up with 2 children, and they seem to be doing okay. But during this time, while he was doing his residency, he gets hooked on Demerol, and he becomes quite addicted to it, to the point where he started having seizures. And I think the reason why he was having seizures is that he was detoxing, from it. So he was able to, like most people in residency, doctors in residency, you think, okay, well, we're going to have to watch this guy really closely, and his license, everything was removed from him, but it was reinstated. So back then that was kind of unusual. Nowadays, it's considered, if you're have an addiction, to have help given. So especially in healthcare, if a nurse or doctor becomes addicted to a drug, at least I can speak for here in Canada, they're paid by the hospital through their insurance to go rehab, and then they're slowly, and the College of Nurses, College of Physicians are involved, and they're slowly introduced back to work into not in areas that don't have as much access to drugs. So they're able to resume their career, watched closely, and stuff like that. But I think in those days, to be busted as a doctor for being an addict and being allowed to come back, I think that speaks of his ability to lie and charm his way into things.
I was just going to say his manipulation skills, and then how you said that the seizures part may have been, partially due to basically detoxing. So when I first started looking into this and looking things up about him, I was very confused on that line, because I thought that he became addicted to it and he was just constantly using it, and then his health started to decline and started getting seizures. But I didn't put 2 and 2 together. I thought maybe he didn't detox until he went away to rehab.
No, I think you're right on both those accounts. His health was declining, and he was an addict, and you have to take more and more and more to keep up with it, right? And the period of time that you have to take it is shorter and shorter. So so you're just driving to get that drug more and more and more. You hear addicts where, they might, I'm going to use a heroin as an example because we already talked about it. So they might have a shot of heroin maybe once or twice a day when they first out, and now they're needing to do it like every couple of hours with higher doses. So it's having access to that medication to be able to do it, right?
Right.
And I'm wondering if him being addicted to Demerol, knowing how the same family of drugs affected his mother, I wonder how that relates, because I'm thinking, did he see the stress taken off of her and how it affected her mood, that he wanted that stress off of him? And why did he feel that stress? And so we're going to be talking later on what his psychopathy is. So I'm just going to leave that as a little, what do you call it?
Cliffhanger?
Cliffhanger, yeah. Sticky note.
A little sticky note.
We'll get back to that. So he was
I'm going to have to use that later.
Yeah, a little sticky note.
I'm going to leave that sticky note for later.
Yeah. So he was diagnosed with having depression. I don't know that he had depression. The seizures were after treatment. So he might have been making that up as well. If maybe not getting, maybe he didn't have seizures and he was looking for an excuse to be like, I needed it to help keep me under control. So who knows really what caused them. And then he was released, but then because of the addiction, he had to face the criminal charges. So he was convicted on 8 charges, and of course forging prescriptions, because that's what he was doing, writing his own prescriptions to get his drugs.
I often wonder how many doctors do that. Like I feel like it's way more commonplace than we even realize.
You can only write so many to yourself, but
But what if you're friends with doctors? They could write them for you and you write them for them.
You can go on and on and on. Exactly. You can write them for a whole bunch of people. You can pay people to go do them for you. So write them to say, let's look at 10 different people. I'll give you $50 for each prescription that you get for me. And then they come back with 300 pills, and it's cost you a lot, but you're a doctor, so you can afford it, right? So
dangerous.
Yeah. So he lost his license, was suspended, but it was reinstated eventually. and he started back up again. He was seeking out to get employment, and he found that there was a medical center. It's called the Donnybrook Medical Center, and he was hired. This was in 1977. But of course, he didn't tell anybody about his depression and addiction issues, but you're supposed to. You need to let them know that. But, he didn't. And he was not very well liked there. And this is when you really start to hear more about his personality. So being cold and aloof and arrogant and superior attitude, he kind of always had that, but you didn't hear a lot of it because people didn't really get to know him. But with people that were working side by side with him, he was just described in all those things. Like he was just, arrogant, condescending, aggressive, abrasive. And he would try to make it look like he was working hard when he really wasn't working all that hard at all. He was able to do max things with minimal effort, right? And he could talk his way around shit. But his patients seemed to love him. And I don't know why. Because I think
because he was manipulative.
He had this obviously old school doctor charm that people still really needed, right?
Yeah. And he was like, I always think of like two-faced, I guess, is the easiest, most lay way to put it. Like, I'm arrogant to the people that I work with because I'm better than them, but I'm so nice and charming to my patients because I need them to trust me so that I can do what I want. And it's just like two different people. Exactly.
And the fact that he was able to split himself like that speaks a lot that he knew what he was doing. So his patients loved him. They saw him as a good old timey doctor, that gave them excellent care. And, I don't know if it's so much now, but for the longest times, people needed to felt that they could trust their doctor. Like they wanted a confident doctor that was almost like arm's length from them in a sense, because that gave that confidence and, intelligence and all that kind of stuff. So he kind of, I think a part of that personality came across too. It's like, oh, he's a strong male physician and he knows how to handle things. So much is let go and overlooked with doctors, because even still doctors this day some of them have God complexes. I'm not saying all of them or even near all of them, but and some patients will just do whatever the doctor says and not question it, not say, I want a second opinion, or they'll just say, oh, the doctor said so. Well, what have you done since then? Like, if you had follow-up, this, that, or whatever. And well, no. Well, and that's not, whose fault is that? I don't know. But there's still this so much trust put into doctors. And there should be. Just that not all, in general, in the world as a whole, not all people are trustworthy. And if you can apply that to general population, not everybody's trustworthy. So why would every doctor be trustworthy?
And
why would every nurse be?
A checks and balances thing, and we're seeing this right now in society as a whole, not even just in the U.S., but with police officers and law enforcement. I mean, there needs to be a line, a checks and balance, because you know what, any person can become a police officer, so therefore any person can have bad intentions. It's not just because you're a police officer you're an awesome person.
Yeah,
granted, there are a ton of good ones, just like there are a ton of good doctors. But when you see the bad apples, I mean, it's forefront,
Yeah, and their damage goes deep, and it goes far. It reaches far because they are in a position of trust. They can get into things and cover things up way more than the average person. So, yeah,
it's scary.
It is scary. So he left the group practice in 92 and he started his own. And what's interesting is he started it across the street from them. Okay.
I didn't realize it was that close.
Yeah. He started across the street and he had all this debt tied in with the company and taxes owed. And he walked away from it. He left them with all of it. And they tried to go after him and he threatened them, and they just kind of went, you know what, it's not worth it. It's just not worth it. So he got away without having to pay any taxes, or he just kind of screwed the company that he left.
So he just had all of these smaller, I mean, granted, it's not technically a small crime, but like all of these smaller crimes happening in the background behind all these murders.
Oh, he was
Like,
always
it's
working it, right? Like he was always trying to get, like I said, maximum amount for least. He was always conniving and doing that stuff. And he took a shit ton of those patients with him to his practice across the street. And so, I mean, that goes to show you the kind of person he is, that he boldly is across the street. He can see where his old practice was. His patients are coming to him, and it's kind of like, and fuck you, or The Simpsons.
I won.
You know? So, yeah. And I believe he called it like the doctor's office, or so it was
so
like,
original.
or doctor, oh God, why can't I remember? It was given a name where it was like, this is the place to go. This is the doctor's clinic. Do you know what I'm saying? Like,
yeah,
that arrogance is, everything else is secondary to my office. Anyway, okay, so he had his own practice, and at one point he had up to 3,000 patients. How do you see 3,000 patients? And I mean, how do you care for 3,000 patients well?
You don't.
You don't. And the majority of his patients were elderly or had some kind of, underlying
Terminal.
like mental health issue, that kind of stuff that sort of kept them at home. He was seeing his patients at home. He was doing house visits. And that was the thing that people really loved about him, is that he would go see them at home. But there was a method behind his madness for why he did that. And a lot of the patients that saw him in his clinic, he would have a completely different personality. He'd be a bit of a dick there, but then you'd come to their house and he'd be like more, gentle and that kind of stuff. So
weird.
So patients of his started dropping off like flies. And so what happens when your patient dies is that you write off that the death and the cause of death, that you pronounce the death and the cause of death. Then you have to have it co-signed by another physician. And then you can determine whether it's going to be a burial or a cremation. Now, it's supposed to be discussed with the family. And they'll say, I want this or that. Well, he was writing them all off as cremations because he wanted to cover up his evidence. So this one funeral home was really starting to notice that, why is there so many patients and why are so many cremated? And then the doctor that was co-signing a lot of his patients started to go, this didn't make really any sense. So then this physician in this funeral home started to talk to each other and go, wait a minute, something is up here. And they were trying to move it up, take it up higher to have people look into it, but nothing came of it really. And after the fact, they go, oh, okay, yeah, we see all this. But like a lot of things in medicine, it's covered up, or people just don't want to deal. Like we just covered the Gosnell case where people just don't want to touch it. Oh, it's, and you don't want to piss off each other as doctors because you don't want to alienate each other, and it can be very incestuous that way. So he started, so they were noticing what he was doing. And of course, his patients were dying. And many of them were elderly, but they weren't actively dying. They were elderly. And so he would come to see them. And when they passed, he had either just left there, just gave them like a vitamin shot or whatever. And
vitamin,
the family would come home and find them posed. So they would either be on a settee, a lounger, whatever they're called. But they would be
chaise.
Yeah, a chaise, or in their bed, and they would have they'd be in a clean dressing gown, and they'd be maybe have a book on their lap or something, but they were definitely posed in this sort of beatific, almost looking calm way.
Yeah, like they were just relaxing and oopsie, they died.
Yeah, and he would say that, and also too that they were very sick, they had pneumonia, this and that, but they'd go into the house and it would be perfect. So if someone who's dying of pneumonia doesn't would have Kleenexes at their bedside, maybe a cup of tea, maybe not made their bed, maybe something on the counter, but no, the house would be perfect. So there was really no sign of them having any acute illness or long-term illness. Now, the other thing he did was that okay, he wasn't supposed to have any access to narcotics, but he somehow was able to finagle in getting them by saying that the patients he was taking care of in the home were palliative care patients and he needed the drugs to get it. Now, what he would do is he would order so much for each person. So patient A, I'm going to just put it down into easy things. We're going to need 10 syringes of morphine. That's usually ampules, all that kind of stuff, but I'm just going to make it easy to follow. So 10 syringes of ampule. Patient B needs 8. Patient C needs 12. And you know what? So he'd be able to get these all pre-ordered. So he had them and he could stockpile them up. So by having all of those, he was able to kill people because he was stockpiling the medication, or he was able to give them so much that they became bedridden. Okay? Or they became sick, low blood pressures, respiratory problems, all related to the drugs that he was giving them. So he not only did he get his hands on them, he was able to pre-order and stockpile them. So when he walked around with his little case, literally it was full of drugs. And so that's how he was killing his patients. And it's funny how he was busted in the long run was
his own fault.
With his own fault, his own negligence, and it came down to money. And I hate when money at the end of the day is what causes murders to finally be, oh no, well, it's involving money now. We need to look into this. So sick. Yeah. So for him, this one patient, Kathleen Grundy, she was young. I mean, not young.
She was young and vibrant.
Oh my God, she was 22 and no. So the one patient that got him busted was Kathleen Grundy. She was 81, but she was full of health and energy, and she worked at a kind of like a soup kitchen kind of place, and she was just doing absolutely fine, and she died. Her daughter, however, was a lawyer. And she was also in charge of her estate. So she died. Her daughter was really surprised by it. Shipman wanted to do a cremation. The daughter's like, no, I don't want that. Mm-hmm. Then the daughter gets a letter in the mail from insurance saying that the mom signed over everything to him. And she's like, nope, that didn't pass by me and I'm the executor, so that doesn't seem possible. Looking at the letter, there was so many friggin' typos and even how it was written. She's like, first of all, my mother had beautiful cursive writing. She would never have typed it. Number 2, she would never have worded it like this, because at the end of it, they wrote okay, here it is. I give all my estate, money, and house to my doctor. My family are not in need, and I want to reward him for all the care he has given to me and the people of Hyde. So he's writing his own, look how fucking amazing I am. Clearly, he's saying, I deserve it because I'm amazing. So he gives his own, he toots his own horn while he's writing this. And it's like, you stupid ass. So his fingerprints were on it. And not only that, his typewriter, where the letters were missing, or he used his own typewriter, didn't get rid of his typewriter, and the typewriter there was in such bad shape that it showed up, with a partial C, or do you know what I mean, or a missing that there. So I mean, he busted himself. Yeah. But you know how he got it co-signed? So he convinced her that the paperwork was for something else entirely.
Yeah, I think it was for a survey, right?
Yes.
An old age survey type.
Exactly.
Aging survey, I think is what they called it.
Yeah. And then he had a young couple in the waiting room that were coming in with their child. And he said, hey, will you sign this for me? It's sort of a release of information or something. So he had it co-signed by a young couple who had no idea what it was. And that's why it was able to go through. And then they found out later that actual signature, and see that there's the trust in the physician. Right? So, anyway, so long and short of it is he got busted through that. They uncovered all his mess, and bodies were exhumed. through a lot of friggin', I mean, that's hard to get a body exhumed, obviously, for the mental and emotional effect that it has on the family. And so many of them were exhumed. Ones that they were able to trace, they could. Of course, they just went deep into in investigating, and they pulled all the stuff together that they were able to get. And he slowly near the end was making a lot of mistakes. Like a couple of his patients died in his office. And like
really?
one patient was a patient that pissed him off. Like he couldn't stand her. Okay. She was one of those patients that's at the doctor every week, has a lot of, complaints, really a lonely person looking for attention. At the end of the day, it's annoying, but that's the worst of it. And so she came in with various aches and pains, and the nurse went in to do an initial assessment on her, and then he saw her, and then when the nurse went back in 10 minutes later, she was dead.
See, and that's a red flag, guys, because you go to your GP, general practitioner, family practitioner, whatever it's called where you live, and normally you don't die there. Normally you just go there to get a checkup, get your little flu shot.
No, you don't die in a general
the turn and cough, whatever, but
like unless someone's going in, because they were having, say, a history of chest pain, shows up as actively having a heart attack, and even then, but yeah, so 2 patients like that died in his office, and other times too, like he had been careless, or because was he careless or was he not? But he had left syringes at bedsides of people in hospitals and stuff like that. But he also knew who to kill. People that already had heart problems, lung problems, all these other things, and that these drugs suppress the center of your brain for breathing and heart rate. So he knew exactly what to do and how to give it and who to kill. So, and then when he was out of the hospital, he just started experimenting how to get away with it in the homes, and he just was able to cover it up and fool people until he couldn't. So, so he was arrested, brought to jail, and tried, and he was put away for life. And in England, that is unheard of.
Right, and this was for only 15 patients, though, right?
Yeah. Sorry. Yeah. Yeah. There's only 15 out of at least we could say 200.
Yeah.
Well, we know it's way more than that, but only 15. Mm-hmm. And I guess, like anything, they figure we can get them on these.
Yeah.
And how many families are just like feel...
Oh, God, hundreds.
And they feel completely unvindicated, not vindicated because why? Because, well, in one sense, it's like, well, we can get them on these, but we can't on these. So let's just do these ones. But I can understand the sorrow and the anger from the family saying, well, what about us? But
yeah, and I think about that every time I talk about a serial killer, because it's like, oh, they got life in prison for this one. This is the one we had the evidence on, but they also admitted to this, but we can't find the body, or we can't find this. We can't pin it to him, but at least he's in jail for life.
Yeah,
and it's like...
And his fantasies or her fantasies are like, haha. And they can, I did it, they'll never find out. And they can just have that little, victory for themselves. It's so messed up. But he's away. I can see it from that perspective. It's better that he's away, not away. But also his behavior in the what do you call it? During the trial was despicable. Yeah. He would smirk and he would laugh or look completely bored, that kind of stuff. So just absolutely, he just felt like he was going to get away with it, and that it was just all a big joke. Now, I just want to go back a little bit to his family. He wasn't tight with his kids at all. Primrose and him had pretty much just a very distant relationship. But at one point during the investigation, before they arrested him, they were able to go get a warrant to go in his house to search for documents, because he was bringing stuff home and hiding them so he could cover up his stuff. When they went into his house, it was disgusting, like absolutely filthy. Okay? Oh. Like a couple other serial killers that we talked about.
Yes.
Right? So it was a friggin' mess. There were like unclean dishes all over the place, dust, cats and piss.
Oh, gross.
just cockroaches. The place was an absolutely disgusting mess. So at his office was perfect, not like Gosnell, but also too, he had people there he surrounded himself with professionals as opposed to the other guy.
Right.
Because he knew at least to be like, okay, I have to give this impression of professionalism, even though, what he was doing. Yeah, his house was gross. And that's why I was saying about Primrose that she wasn't maybe such a, a catch because, yeah. And, that's just basically, so that there's that situation. So I find that very interesting, that his home was just so gross. So yeah, so that kind of just, well, no, I'm just kidding. There's just one more thing. He ended up committing suicide after he was found guilty. And he did it about 2 years later, 18 months later, because he was waiting for the insurance to go through so his wife could have money. So it's probably the only kind thing that he's ever done.
I was just going to say, that's so left field. I would not expect that of him.
Yeah.
I would expect him to like make sure that nobody got that money if he wasn't going to.
He actually put off killing himself so that his wife could get insurance. So it's like the only thing, and I know that is out of left field. It's like, what? That doesn't make any sense. But I don't know. I guess he had a little bit of loyalty for her somehow, or had a little bit of fondness in there somewhere. So yeah, that's it. That's sort of a broad paint stroke of what happened or what he was all about. So now, okay, so Heather, it's time for you to jump in. I am so excited with how you're going to break this down. So
okay,
here we go.
Let's hope I don't disappoint. I am not a doctor.
Disappoint.
Just remember that. Of any kind, the murdering kind or otherwise. I'm not.
Yeah. Wink.
All right, so this one was fun for me. I know that sounds weird and really bad, but it was fun.
No, I know what you mean.
So the why of it all, and I got this little guy out.
She's got a DSM-5. It's like
I do.
I'm gonna be getting one soon.
It's a Bible for me.
I've got one on order as well. No, it is. It's like a Bible. Yeah,
it is. It's so interesting.
After you told me about yours, I was like, she's like, I got it on Amazon. I'm like, click, 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 click.
Click, 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 click. Yep. Amazon's been my savior. Yeah. Okay, so he covered all of his tracks every step of the way. You kind of went into that. He would alter records, which they found out later because, hey, Shipman, guess what? Timestamps. When you change something in the fucking database, it's going to show when you did it.
Absolutely.
Guess what? She was dead 3 weeks ago.
It shows
like,
up.
What the hell?
And here's the thing that he thought he was being so progressive getting a computer system in. He's like, look at me. I've got the best of the best. And he didn't even understand how computers worked. Like, he didn't understand the time stamping. So he screwed himself thinking he was so smart.
If he would have just changed the time in the computer, then, he could basically travel in time.
Yeah, well, true. But he just
he's an idiot.
And that's where they're too smart for they outsmart what they think is smart. They're really not all that smart, right? Their arrogance, like it takes over or something. Okay.
Every time I talk about a new criminal, I'm like, man, he's so dumb. And I'm like, wait, what criminal is smart? Obviously none of them.
Yeah. They're more, their intelligent lies in their criminality, right?
Right. So aside from altering records, he would falsify death certificates, basically, saying they died because of X when it was really Z. He's the one who killed him. He abused the trust that the patients had in him. As you talked about earlier, they all had a lot of trust in him. They really respected him. And he abused that. He used that to his full advantage, especially when he was in their homes, like in their safe space. Yep. When in reality, that was his safe space because he could do whatever he wanted to them.
Exactly.
So as we talked, he probably left almost 300 families without loved ones. And I would say that it was probably upwards of like 500 families, honestly.
I agree with you 100% because I can tell you, I mean, I've said it again and again and again, but doctors and nurses, healthcare workers professionals are the most dangerous. That's my opinion. Because you are in a position of trust, so people want to trust you or do trust you. You have access to drugs that are readily accessible, more or less, depending on what you use. and you have the knowledge to work it, to choose your patients, to be able to hide it. And because most documentation starts and ends with a physician or a nurse, they can cover it up really well. So they can go on, like, as long as you said, like, who knows how many he actually killed or tried to.
Right. And the whole trust thing, like, you know, you go to a doctor because guess what? You're not a doctor. You don't know these different things about your body and these illnesses, these sicknesses. You're trusting that person in your most vulnerable time. You want to get better. You want to feel better. And this person's supposed to help with that. They're not supposed to abuse it.
And if he had a clientele of 3,000 patients for, say, like 10 years, and that would be, you know, rotating, it's not, I don't think it's unfair or out of the realm to say that 500 is, you know, it seems astronomical, and it is, but it doesn't seem to be out of the realm of possibilities that it could happen.
For sure. Especially with, and we'll get into it, with the way he operated. His mindset is just his pure lack of remorse, empathy, anything human. Honestly, he's like an animal.
Yeah, he is an animal. And also too, if you feel comfortable with what you're doing, you're not as noticed, right?
Yeah.
And so you just kind of look, you know, casual doing, and people don't look at you. And this is kind of what he became, you know, he was good at, again, until he wasn't, but
yep.
Okay.
Always good until they're not.
Yeah.
So most of the explanations for why he killed his patients are probably too simple, and we've kind of talked about a few of them already, but immediately what everybody thinks of when they try to justify his actions is, you know, there must be some childhood trauma, that he must have mommy issues, quote unquote. I don't like saying that, but you know what I mean.
Yeah.
So some questions to think about, though. I found this in a very interesting article, and of course I'll send it all to Karen so that you guys can read it as well.
Yeah.
So basically, did he witness his mother suffering and believe that sudden death at the end of a trusted and friendly physician's syringe was a preferable option? And when you think about it in the grand scheme of things, that's kind of what palliative care is.
Yeah.
You know, you're in there, you know you're going to die, or at least your loved ones know that you're on your way. And palliative care is literally just comfort care until the end. And then you move to hospice. So it's basically exactly what that question is. That's the answer, you know?
Yeah.
Did he hate women? Most of his patients were women. And for reasons that we can't understand maybe, but maybe we can. You know, his relationship with his mom is a huge red flag for me.
Yeah, I just think it was so, like, she smothered him. And he probably, like, he needed her attention, but he probably hated a lot of it.
Yeah.
Do you know what I mean? Like, he had to have it
to thrive and to succeed, but it also hated it at the same time.
Smothered him as well. So you could see why he would love and hate his mom, because he needed it. Yeah. But he also, it was too much.
Yep.
And then so this is something I wrote a couple of notes down. This is the one thing I wanted to ask you. So being that she had showered so much attention on him, and in her dying, that was all taken away. Did he blame her? And is that where some of the hatred was, like, you know, to be coarse, to say, fuck you, you've given me this whole time, and now you went and died on me?
Yeah, and you took it away from me, and I cared for you?
Yeah.
And now you just leave me? What am I supposed to do?
Yeah, and, like, I'm terrified that you're dying. I want you to not suffer. The suffering is relieved by this guy. I am fucking confused. Do I want you to live? Do I want you to die? I need you, but it's been too much. So at the end of the day, the one person that, you know, created the monster also left the monster. And, you know, his dad didn't really give a shit. He had no relationship with his siblings. He didn't have any friends to speak of. So he didn't have really any girlfriends, and he meets a woman that he doesn't give a shit about, but it made him, you know, try to make him look, it was good for his image. So I don't know. That's what I wanted to ask you. What do you think about that?
Yeah, I completely agree with all of that. And something too, I think that goes a little bit deeper is Yeah, I feel like he is hurt and pissed that, she created this relationship with him. She created him in this sense because, like, she's all he knows. And then she goes and dies on him. But at the same time, he feels like he's the one that was taking care of him all the time. But the doctor reaped the benefits because the doctor provided this little, shot of magic juice that made her feel good. And then she died, and everything he did was for nothing. So he did everything he could to care for her, but it did nothing.
So the doctor gets all the credit for the relief of how her
she's
pain
feeling
and suffering.
Yep.
And even though he's there, he doesn't really get any credit for it.
Exactly. He's doing all the work. He's caring for her. Nobody else is there. His dad's not there. His siblings aren't there to care for her. She's all he has and knows.
And then the hero comes through the door.
Yep. And then leaves.
And then leaves.
Has nothing. He doesn't have to clean up anything. He doesn't have to care for her.
Wow. Yep.
Yeah.
100%.
So I feel like there's definitely that connection. There's that hatred, that resentment, if you will. Another question is, was he clinically insane? Was he terrifyingly sane? Those are two polar opposites, but could he be both? Possibly.
I think you can
in
be,
certain aspects. I think he can be sane, but also
I think he was sane because I think he was terrifyingly sane because he knew what he was doing.
Yeah.
So
he did it with such calculation.
I think he was aware. People, here's my thing. People don't cover up tracks if they think they're doing something right. You don't cover up a track if you don't see the track you don't see a track that needs to be covered up.
Right.
Right? Like if I eat all the cookies and I think it's fine for me to eat the cookies, I just leave the container and the cookies crumbs all over the place and be like, yeah, I ate them. Or I go out and buy more cookies, stick it in the container and try to pass them off as home-baked cookies. Do you know what I'm saying? And say, I know
somebody who did that, and I'm like, I can tell the difference.
Yeah,
okay?
So, you know what I'm saying, though? It's like, kind of like that deal is that one, I'm like, yeah, that's right, I did it. And the other one is like, I'm going to cover it up, but it's obvious. But you know my point. So I think he knew what he was doing. He just I think he just stopped giving a shit. He was so arrogant that it was like, I've gotten away with this for so long, I'm going to get away with it forever.
Catch me.
Yeah, so... I think terrifyingly sane. What do you think?
I agree. I think I get into it a little bit more later, but yeah, I'm leaning more towards that one.
Okay, cool.
So then another question, was he just obsessed with power? We've talked about the God complex. Mm-hmm. So power that was perhaps exemplified by his choosing the time and manner of his own death, not just his patient's, but his own death. Like you stated, he calculated that timing perfectly to make sure that his wife would get the insurance money. Yeah. I didn't know that aspect of it, but I knew that he chose when he wanted to die, He
had control to the very end. So control over money flow and control over his own death.
Yeah. God, I would be so interested to hear from his kids, which obviously they probably don't ever want to talk about this with anyone, but Jesus, I'd be interested to see how they turned out.
Yeah. I think one of them became a doctor.
Oh, fuck me.
Yeah, no, but
if you guys ever run into a Dr. Shipman, don't fucking go.
No,
Jesus.
I think he was fine. I don't know. Nothing's come out, so.
So, back to the mom thing, just 1 second here, because I thought about this the other day, and I was like, I don't think I added that, but this is super interesting. So, like how you said she smothered him. The word mother is in that. There's like a connection there. Yeah. And I think there's like a whole thing behind that, which maybe we could get into it another time. But have you ever realized that, so like mom in like basically any culture is almost the same word. So mom, mama, ma, mum.
Yeah.
Like they all start with that. Do you know why that is?
No.
It's because when a baby is a baby and they're trying to learn how to talk and they're trying to mimic their parents, the first audible noises that they ever make is always like a
okay.
So like it's just easy for them. So like mom is usually the first word anyway, and it's just an easy thing for them to say.
Yeah, because versus duh.
Yeah.
I don't
So
think
it's
any
just so
baby
easy,
learns how to
like-
say father right away.
No.
Could you imagine?
No. Father.
6 months old.
And that's all
Mama.
you hear.
Father.
Father. Yeah. Like, who was that? Oh, I think it was baby Joseph. Like,
Father.
father. And then they just start crying because they're a baby and they can't say actual words.
Oh my God. So that's
So
fascinating.
creepy.
That's fascinating.
Isn't it?
Yeah. So
So choosing his own death, we see that. Many theories about serial killer behavior revolve around socioeconomic frustration, and we've talked about that before off mic, but we also kind of talked about it in Gosnell's case. And that's sometimes referred to as homicidal protest. So sometimes serial killers will target people from powerless groups, so like minorities or people who are very poor, people with addictions, sex workers, just the, you don't have money, you don't have resources, you do what you got to do to survive. Those are usually the targeted groups, elderly. So other theories, in his case, he's addicted to murder, which I think that just comes with it. I don't think he just started killing because he was addicted to murdering people.
yeah.
I think it just kind of happened over time, and as he got better, quote unquote, at it,
He
that was
needed
the
that-
addiction. He just
needed that
continued
power.
doing it.
Yeah.
Maybe simply he wanted to steal from the victims. Jewelry was stolen from some of the victims. I don't think this one's a relevant theory in this case. I think that if that was the motive for him, then he would have had just like an entire house full of things. You would have seen tracks where he maybe sold it or used it or gave it to somebody.
I was
There
wondering
just
though if
wasn't
he was
enough
keeping them as
evidence.
trophies.
And that very well could be, but that wouldn't be to me, at least, a serial killer wouldn't kill somebody just to have that item as a trophy.
Okay,
They usually
so-
get the trophy after they kill him just to
Gotcha.
remember the death.
Okay, yeah. So I mean that wasn't what drove it. It was maybe
Right.
financial and maybe also like maybe
Yeah.
not necessarily a trophy, financial gain, but
Yeah. Yeah, and I think I see it a lot, at least like with serial killers, that they want to remember that kill.
Yeah.
So they take something sentimental, and I keep
Yeah.
using air quotes for you
Yeah.
guys, but sentimental to them because they can look at it and be like, yeah, I remember that kill. I remember I was here
Yeah.
and I did this, and then this is how I did it, and this is how he or she acted.
while
I
it
heard
was
he
maybe
or she
personally on
scream.
them as opposed to like being in a jewelry box or something like that.
Exactly.
Okay.
Yep.
Okay. Cool.
Yep. So it just kind of reminds them of them.
Yeah.
Or he had a particular contempt for women. We've talked about this a lot, and I don't think it was women per se. I think it was women who reminded him of his mother.
Yeah.
They were all elderly. I don't think any of his victims actually, confirmed victims or otherwise. I don't think any of them were under the age of like 49.
No.
So they were all up there.
There was a few that were like 50 to 60-ish, but the majority of them
Yeah.
were 70 plus.
Yeah. And it's, and there's several reasons for that. The whole mother aspect, I think, is a huge part of it, but also elderly population, easy. They're already terminally ill or they're already having some type
Just
of issue.
vulnerable.
So it'd be easier for him to, one, kill them, but also to cover it up, to hide it as, natural causes, or she was already terminally ill,
Yeah.
so it was her time, that kind of
And
thing.
that power over life and death, right?
Exactly. Because he gets to choose. Yeah, they're dying, but they're not dead yet, but I can make them dead right now.
Yeah. So I am going to end this episode right here. There is so much more to talk about. Heather gives such a fascinating outlook on Shipman, and we have such a great discussion. So I think it really needs to be broken up into two, because I think you'd probably fall asleep after 2 hours. So anyway, so I'm going to end it here. And there's a couple things that I want to say. I want to thank Caitlin's13 for the wonderful review. Thank you so much. I love these reviews, guys. Keep them coming. It means a lot, of course. I know I keep saying it, but it's because I mean it. I love the reviews, and it makes me feel warm and fuzzy inside. Also, I want to give a big shout out to my new Patreon supporters, Sonia McDonald, Lisa Tate, and Sarah Winterstein. Thank you so much. It helps out a ton. And I know in this day and age, money is tighter and harder to come by. So it's a lot that you're helping me out that way. And if you're interested in becoming a patron on Patreon, there are different perks that you can get in different price ranges. And part of it is extra episodes. I have been bringing out a few more Suture Room episodes. And also some swag giveaways, and depending on which tier you pick, there you get some swag with it. And I also leave it open to the patrons to also let me know what they'd like to hear more of. So I have a link in the show notes if you want to check that out. Also, there will be links to what Heather referenced in some of her findings in her research. And I just, it means so much to me that you guys are still listening in this crazy world we're in. COVID is still going strong, but together we can fight it and keep each other safe and sound. And that's the most important thing. So let's take care of ourselves and take care of each other. And most importantly, love yourself. Peace. One love.
To me, I didn't think she was a runaway. It was more as a missing person than a runaway.
Many cases are investigated and solved quickly. The guilty arrested and put behind bars.
But some cases are more complicated.
So then I listened to the 911 call, and the 911 operator was given instructions to tamper with the crime scene.
Some cases linger for months or years even.
It hurts to remember him not being here.